How are we doing, YouTube? Nick Pratap here from Next Gen Rehab, and in today's video I'm going to be going over the question on whether or not it's safe to exercise after having a stent put in after a heart attack. Alright, so again, I'm not a medical doctor, and this in no way, shape, or form is meant to be medical advice. If you have any medical questions, those should be brought up with your family doctor. And obviously after this video, if you do still have questions, talking to a local cardiac rehab program is the most suitable for you. I do not know your health history. This is just meant to be for educational purposes. All right, so let's backtrack a little bit. What exactly is a stent? So if you're someone or you know someone that's had a heart attack, generally speaking, what's happened in this situation is there has been some sort of block or occlusion within one of the major or maybe even multiple arteries of the heart. All right, and so when this blockage happens, you're going to be going to the hospital. They're going to run you through a battery of tests, put you or set you up on an ECG. You can do some blood work to check what's known as the troponin levels. If they see that you're having a heart attack, they're going to run what's called an angiogram, which allows the interventionist to see, okay, to what degree is this person's heart blocked, how many blockages are there. Okay, so if there's multiple blockages happening and it's quite severely occluded, then your interventionist may have you undergo a bypass, all right, a bypass surgery, which we can talk about in another video. But if it's a single blockage or smaller blockages within your heart, then your interventionist may allude for you to have a stent put in. Okay, and what a stent is, you can think about like a little mesh that gets inserted. All right, so you undergo what's called an angioplasty, where they thread a catheter in through either your radial artery, up in through your groin, all the way to your heart, and then they feed this kind of balloon up through the catheter that has this stent at the end. They get to the blockage, they expand this balloon, again with the stent at the end, deploy the stent in the area where the blockage was, and then they remove the balloon along with the catheter, and that stent remains there. It kind of meshes in with the endothelium or the layer in the artery, and that's what allows the blockage to be reopened and blood flow to be resumed to the different areas of the heart. Okay, so it's not a aggressive intervention, right? You don't have to get your sternum opened up like you would with a bypass, and so generally speaking, depending on how intensive it was, they may keep you overnight, send you home the next day. You might have to stay a couple days. But after having this done, you're going to be put on specific medications. One is known as a dual antiplatelet therapy, where you put on multiple blood thinners, 2 blood thinners to be exact. And this is just for a period of a year to prevent any sort of clot formation from happening. Okay. Along with that, to help control cholesterol risk, you're going to be most likely put on some sort of statin. And then depending on the degree of functionality of the heart, whether it's loss function or not, you're going to be put on certain medications to potentially bring that heart function up. You might be put on some medications to help with blood pressure control. So again, these are conversations to have with your cardiologist, and it does change from a case-by-case basis, but generally speaking, you put on the blood thinner, statin, and usually a blood pressure regulator. Okay, and even sometimes what we call a beta blocker to help regulate heart rate. Now, after having all this done and after being discharged from the hospital, the question is, well, what should I be doing next, or when should I be exercising? The best piece of advice I can give you is getting a referral to a local cardiac rehab program near you. Okay, so I always use the analogy of, okay, well, if you've been injured, right, and you, hurt your knee or your ankle, right, and it's swollen, you're not going to just wake up the next day and go for a run, right? You're going to make that injury a little bit worse. Same thing with the heart, right? Your heart is a muscle, and you don't want to just, after a heart attack, go start doing sprints within a week, right? You're going to put a lot of extra stress on that heart, and potentially, you can cause a little bit more damage. So instead, getting the proper guidance, getting the proper guidelines on what's a specific way of exercise for you will be very useful. And so being referred to a cardiac rehab program is generally the first route. This can be done by either your cardiologist, it can be done by your interventionist, it can be done by your family doctor. A lot of the time these referrals are automatic, but sometimes they need to be facilitated. And so once you get referred to these programs, what these programs are going to do is, hopefully within that first 4 weeks of having a heart event, they're able to send you for a stress test, initial stress test, to see the extent of how hard we're able to push you now, exercise-wise. All right. So again, it's roughly that 4 to 6 week window. After having that stress test done, your exercise team, cardiologist, exercise physiologist will get that information and see, okay, well, are there any rhythm issues? Is the heart getting enough blood flow? In terms of exercise, what's this person's exercise tolerance and capacity? Okay, and then so after getting all that information, you're able to get enrolled into that program, hopefully within the first 1 to 2 months. And then once you're in the program, proper exercise guidelines, nutrition guidelines, psychosocial guidelines will be provided to you in terms of managing exercise, right? So I've talked about in previous videos, things like the target heart rate will be assessed based off that stress test. Things like the Borg scale will be taught to you on and rating of perceived exertion, knowing how hard you should be pushing yourself. Based on the medications you're taking, you're going to be given proper guidance and education on what are appropriate things for you, what are things that you should not be doing, depending on symptoms, right? If you're experiencing any sort of symptoms during exercise, at least that exercise physiologist is monitoring that and can relay that information over to the doctor, saying, hey, so-and-so is always getting dizzy at this specific heart rate or at this intensity. Is a potential change in medication needed? Even when they're walking around, they're starting to get dizzy. You might be someone that's a little bit more sensitive, right? So while being in these programs, again, you're also having some blood work done to just check your cholesterol levels, your blood sugar levels, to make sure that they meet the proper guidelines and requirements, because those can potentially become risk factors in and of themselves to developing heart disease again down the road. And you're also getting followed up with your blood pressure. Again, we want to keep this in a manageable range, 120/80 or below normally. If it's getting above 130, 140, again, some intervention may be needed. First off is always lifestyle, right? Weight loss, nutrition changes, exercise. If we're still not seeing a drop in blood pressure after making those changes, or again, it can go across the board, right? If you're someone that had high cholesterol and we're still not seeing these changes after those lifestyle changes, or if you're diabetic or borderline diabetic and we're not seeing those blood sugar levels come down after, again, changing your diet, exercising, managing your stress, then the doctor may choose to put you on certain medications, all right? So in the long term, after having a stent put in, is it safe to exercise? Yes. But I do highly encourage you to do it with some trained professionals. Absolutely, you can do it, but you will be given some proper guidelines on how you should be exercising and what intensities are going to be appropriate for you based on the medications you're taking. All right. So hopefully you found this video helpful. If you do have any questions, please feel free to leave them in the comment section below. Once again, this is Nick Pratap from Next Gen Rehabilitation. We'll see you in the next video.